Welcome to Health Matters, brought to you by the Office of Correctional Medicine at Southern Illinois University School of Medicine. This video is for informational and educational purposes only. It is not intended as medical advice and should not replace consultation with a qualified healthcare professional. Always seek the guidance of your doctor or other licensed medical provider regarding any questions you may have about your health or medical condition.
Hello, and welcome to Health Matters, an educational series brought to you by the Office of Correctional Medicine at Southern Illinois University School of Medicine. My name is Dr. Benjamin Montgomery, and in this video, I'll be discussing testicular cancer. The testicles are the oval-shaped organs located in the scrotum in the sac of skin situated just below the penis. Their primary functions include the production of sperm for reproduction and the secretion of hormones such as testosterone. Testicular cancer arises from abnormal cell growth that can occur either inside or on the surface of the testicle. While testicular cancer is relatively uncommon, it is the most frequently diagnosed solid tumor cancer in men between the ages of 15 and 40. 1 in 250 men will be diagnosed per year, with the average age of diagnosis of 33. Several risk factors have been identified for developing testicular cancer. They include your ethnicity. White men are at a higher risk compared to African American, Asian American, and Hispanic American men. A history of cryptorchidism, which is a condition that involves one or both testicles failing to descend from the abdomen into the scrotum before birth. A family history of testicular cancer, particularly in a brother. A prior history of infertility may also be a risk factor. Other potential risk factors include a history of HIV or HPV infection, a history of orchitis, which is an infection of the testicles, tobacco use, cannabis use, and exposure to certain occupational chemicals. So what are the symptoms of testicular cancer? A person may experience blood in the semen, pain or heaviness in the scrotum, a painless lump, swelling, or enlargement of one or both testicles, an ache or pressure in the groin, abdomen, or lower back, and in advanced cases, symptoms may include fatigue, fever, excessive sweating, cough, shortness of breath, and chest pains. Although there aren't any official recommendations for routine screening, performing a testicular self-exam can be beneficial for early detection of any abnormalities. To demonstrate, I'll be using this model of a scrotum. To perform a testicular self-exam, it's best to do this in the shower when the scrotum is relaxed. Start by observing your scrotum for red, swollen, tight, or tender areas. Then, to check your testicles, use your thumb and first two fingers to gently roll each testicle between your fingers and thumb. Note whether the surfaces feel smooth like a marble, or if you can detect any hard lumps or rough areas. Pay attention to any changes in size, shape, or consistency. And additionally, feel the back of your testicles where the spermatic cord is located. These feel like small ropes, and note any significant tenderness, masses, or swelling. It's important to see a healthcare provider if you discover any concerns during your self-exam. Your provider will conduct a physical exam and may order blood tests and an ultrasound for further evaluation. Treatment options for testicular cancer typically include surgery, chemotherapy, and radiation therapy. With effective treatment, the cure rate for testicular cancer exceeds 90%, so early detection plays a vital role in achieving the best outcomes for recovery. Therefore, I encourage you, especially if you have any of the risk factors discussed, to perform self-exams and contact your provider with any current concerns. Thank you for watching. I'm Dr. Benjamin Montgomery, and invite you to look for more educational content in our Health Matters series brought to you by the Office of Correctional Medicine at Southern Illinois University School of Medicine.